Let's take a minute to talk about how to use an EpiPen or EpiPen Jr. This medicine treats someone who is having a life-threatening allergic reaction. It is important to always keep this medicine with you. Allergic emergencies can happen at any time and very quickly. If you think you're having an allergic emergency, use your EpiPen right away. This medicine comes in a prefilled pen that uses a very small needle. When you're prescribed an EpiPen, make sure your healthcare provider teaches you how to give the injection. Also, be sure to read the instructions for use. Your prescription will come with a trainer for you to practice and get familiar with this medicine. The training device does not contain a needle. It is important to know that each EpiPen only contains one dose. You should only inject the dose into the middle of your outer thigh. You can inject it through your clothing if needed. Let's get started. First, prepare the dose. Flip open the cap of the carrier tube. EpiPen has a yellow cap. EpiPen Jr. has a green cap. Now, slide the EpiPen out of the carrier tube. Hold the EpiPen in the palm of your hands inside of a fist. The blue tip should be pointing up. The orange tip should be pointing down or towards the thigh. The orange tip is where the needle is. This is the part that will be injected into your thigh. An easy way to remember how to hold your EpiPen is the saying, blue to the sky, orange to the thigh. Now, remove the blue tip by pulling straight up. You will not need to twist or bend it to remove. To avoid an accidental injection, never put your thumb, fingers, or hand over the orange tip. If an accidental injection happens, get medical help right away. You are now ready to give a dose. If you're giving the dose to a child, hold their leg firmly in place. Swiftly inject the orange end of the pen into the thigh. You will hear a click. Then, hold in place for 3 seconds. Now that you've administered the dose, remove the pen. Massage the area for 10 seconds. If you had to use an EpiPen, you must now call for emergency help. Remember, one EpiPen only has one dose and cannot be reused. If symptoms of a severe reaction do not go away after 5 to 15 minutes, you can give another dose of EpiPen if a second one is available. And that's it. These are the basics of giving a dose of EpiPen. For best results with EpiPen, use it at the first sign of an allergic reaction.